With the staggering number of COVID-19 cases and deaths that we're reporting tonight, this image has some additional meaning. This is Dr. Joseph Varon, head of the coronavirus unit at United Memorial Medical Center in Houston. You see him there in his full personal protective equipment, embracing an elderly COVID-19 patient on Thanksgiving Day. This now viral image says it all. It captures the pain and loneliness of the sick and the compassion of the exhausted healthcare workers who treat them. We are joined tonight by Dr. Varon. Thank you so much for your time and certainly for the important work that you're doing. Clearly, this is quite a touching moment that we're seeing in that picture. Give us the backstory of how this came to be.
Well, I mean, as you probably know, I have been very open with the media, and I've been trying to get the media to show what goes on in our COVID unit. So that particular day, I had Mr. Go Nakamura, who is a photographer, who was just taking pictures for one of the picture companies. And as we go into my unit, I see that this man is standing up next to his bed, and he's crying. I forgot that I had a photographer behind me, and I just went straight to see the patient. When I see this man, he is crying. He's crying like a baby, and he is very, very sad. So I get close to him and I ask him, "What's going on with you?" And he tells me, "I want to be with my wife." So you see this elderly gentleman who wants to be with his wife. I guess any of us would have just, grabbed him and hug him. And that's what I did, without knowing that Mr. Nakamura was behind me just taking pictures. So, I sit down with the patient. I finally calm him down. And the next day, people are calling me, "Hey, your picture is all over the internet." I said, "What picture?" I didn't even know what picture they were talking about.
And what kind of toll does the isolation have on these COVID patients? And do you think that it might play a role in the outcome of their health?
Absolutely. There is no question that, when somebody gets depressed, when somebody doesn't want to live, when somebody loses that will of living, they can die. And the isolation that patients have in a COVID unit, it's tremendous. I mean, you are there in a room where nobody can actually talk to you. Your family cannot be next to you. You have people coming to you, in these space suits. And the problem of that is that you feel isolated. You feel lonely. And even though I try to get my team and myself to go ahead and bring in pictures of ourselves so that people can identify us, it's not the same. People lose track of time. It really can make a difference in their outcome.
And we've been talking about the patients, but also talk us through the agony for the families who at best only are able to have maybe a video call but not be physically present to hold the hand of their loved ones in oftentimes their most dire hour.
And you are 100% correct. And and that's particularly more difficult for the elderly. People that may not be so technologically savvy, may not know how to make a video call. Even if we help them, they are not used to see somebody on a phone instead of, having somebody hold your hand. So it's a very, very sad situation.
And when you've been talking to those family members and you have to pass along oftentimes some really morbid news, how does that go, especially when it's a phone call? They're not there in person.
Well, I mean, to be honest with you, as a healthcare provider, it hurts. And it hurts to see that somebody may be in their last minutes of life and they cannot have their loved ones next to them. I mean, this pandemic really has taught me that at the end of your life, sometimes people can die alone, and that's very sad.
And you said that you've worked 259 days in a row, which is just astonishing, especially in such tough circumstances. What does that feel like, and why haven't you taken any time off?
Well, I mean, it does get a toll on you. I mean, you need to see my nurses, my colleagues, my friends. Everybody gets in trouble. My nurses start crying in the middle of the day because they keep on having patient after patient. I have kept my adrenaline going. I've looked at some projects that I can do to just, get us happy. For example, we were involved in a music video just to lift up that sense of doom that we have as clinicians. I mean, we get so tired of seeing patient after patient after patient.
And how have you managed to keep yourself healthy from both the virus itself and just how taxing this all must be emotionally, apart from the music video?
To be honest with you, I truly think that I probably have some degree of immunity, because if I haven't gotten it in 259 days, that's actually quite impressive. For a period of time, I was not eating well. We were eating whatever we could because we were spending 16 to 20 hours a day in the hospital. In the last few weeks, I've actually tried to exercise, and that's helping relieve the stress as well.
And finally, want to play that music video that you were just referencing, something that showcases some of your other talents.
We're trying to save the lives of oh so many strangers. This is what we do, day in and day out. This is what we do.
Tell us about this and how it's helping healthcare workers who are on the front lines.
Well, I mean, there is no question that one of the things that you see is that the healthcare workers are getting burned. So, the person that went ahead and did the lyrics and did the music, he reached out to me and said, hey, what do you think about this? And I said, that sounds like a great idea. The music was nice music. And I think that this helps you by lifting up your spirits. I mean, we are so exhausted, so tired. I think that healthcare workers around the globe can actually, lift up their spirits just by listening to this music video. And you can find it at healthcareworkersrock.org. And it's really, really a fun video. I had a blast creating the video with my colleagues.
I feel inspired just watching that and listening to you talk to us. So thank you very much, Dr. Varon, for all you're doing, for your time, and we hope you get some rest soon.
Thank you very much. Thanks for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.